Hello, I'm Lucy. I'm a third year from Case Western. My question tonight is for Chris and Dr. Berland. How do you foresee the field of vascular surgery changing in the near future, and then within maybe the next 10 years or next few decades?
I guess I can start and tackle that. Vascular surgery, one of the enticing things about this field is that it's always changing. So for example, 20 years ago, endovascular options for aortic aneurysm repair were not as sophisticated as they are today, and most people got an open repair. Today, if you walked in with a favorable infrarenal aortic aneurysm, chances are that you will be offered and get a good and solid endovascular repair. And so I think that not only has that paradigm shift happened, but also the technology that goes along with it happens. And there's only more that's coming along the horizon. We're constantly seeking innovations that will help our patients and that will provide for them treatments that are less invasive, but also durable. So that's one thing. The other thing is, there's people who are doing, who are, I guess, interested like me in really advancing the vascular armamentarium of medications that are available for us, for people who have critical limb ischemia, who suffer from diabetes and just can't get blood flow to their limbs, et cetera, et cetera. So I think that that's a new area that's gonna blow up within the next few years, hopefully. And then you also have just education. So I think have things like education and mentoring. We have a lot more people entering the vascular workforce these days, and it's very diverse group of people entering the workforce these days. So I think having mentors that are able to speak to you in a way that kind of get you in that sense is going to be even more critical for vascular, and that's going to be a way that the field changes and evolves and even gets better in the future.
Very well said, Chris. I'll echo a lot of the same, starting with the pharmacodynamic part of this. It's amazing to me. I was trained in the era of like Lovenox and Coumadin, and when DOACs came on board, it was like, wow, you can give this kind of blood thinner and not have to check anything. That just seemed crazy. And now to look and see that factor 11 inhibitors are on the horizon, where you've got a medication that can attack the extrinsic pathway for coagulation and prevent blood clots, but not have any issues with increased bleeding, particularly during surgery. You could do a giant surgical operation on one of these medications and not experience any more bleeding. That is just crazy to me. And that's just right around the corner. Where we're going to be in 10 years, I think I can't even imagine where the medicine side of it's going to be. But I will say, I remember thinking about this early in my career, probably about year 3 or year 4 out from training, probably about 80% of what I was doing, I was not doing as a fellow. And now being 12 years out, probably 90+% is different. And so that's why you're constantly evolving. Aside from like an open carotid endarterectomy, maybe a surgical fistula creation and a baloney amputation, that you kind of get during training, and you get faster at those and a little bit quicker and probably a little technically better, but that operation doesn't change. The endovascular part is constantly evolving. And so that's really what changes. So every few years, the whole armamentarium changes. The devices are different, your approaches are different, the access vessels are different. So it's really amazing. And that's one of the cool parts of vascular. It doesn't get old.